you, Senator Enzi. Senator Sanders.
Thank you very much, Mr. Chairman. The official statistic, Dr. Fauci, is that 80,000 Americans have died from the pandemic. There are some epidemiologists who suggest the number may be 50% higher than that. What do you think?
I'm not sure, Senator Sanders, if it's going to be 50% higher, but most of us feel that the number of deaths are likely higher than that number because given the situation, particularly in New York City, when they were really strapped with a very serious challenge to their healthcare system, that there may have been people who died at home who did have COVID, who were not counted as COVID because they never really got to the hospital. So in direct answer to your question, I think you are correct that the number is likely higher. I don't know exactly what percent higher, but almost certainly it's higher.
Dr. Fauci, let me ask you this. Are we fearful that if we don't get our act together, as bad as the situation is now, it could become worse in the fall or winter?
Well, Senator, thank you for that question. It's a frequently asked question, and I think that possibility does exist. However, and the reason I say that is that when you talk about will this virus just disappear, and as I've said publicly many times, that is just not going to happen because it's such a highly transmissible virus. And even if we get better control over the months, it is likely that there will be virus somewhere on this planet that will eventually get back to us. So my approach towards the possibility of a rebound and a second wave in the fall is that A, it's entirely conceivable and possible that it would happen, but B, I would hope that between now and then, given the capability of doing the testing that you've heard from Admiral Giroir and the ability of us to stock up on personal protective equipment and the workforce that the CDC under Dr. Redfield will be putting forth to be able to identify, isolate, and contact trace, I hope that if we do have the threat of a second wave, we will be able to deal with it very effectively to prevent it from becoming an outbreak, not only worse than now, but much, much less.
Okay, well, let me ask